Hey guys, welcome to another episode on the Move, Talk, Thrive podcast. Today I'm here to talk to you a little bit about client retention. This is a really important piece in pediatric practice because there's so many gaps or potential gaps in servicing. So there's so many leak opportunities for clients to step out without anyone actually realizing or understanding why. So I thought it'd be really good for me to talk about what I've been focusing on in my business in the last few months when I started to look at retention and look at why people were dropping off and how many were dropping off. Because retention is not an admin problem, it's clinical leadership. It's something that I think as clinicians we need to be aware of, and of course, as business owners and leadership teams, we need to be managing effectively. So, with that being said, let's look at retention as clinical leadership in this podcast today.
We are child development obsessed business besties and mums, and we're here to spill all our secrets.
We have a combined 30 years experience working with children, and each episode we will bring you up-to-date research and evidence-based strategies to set your children up to thrive.
I'm Lizzy Dawson, Australian exercise physiologist.
I'm Emily Mackey, Australian speech pathologist,
And this is the Move, Talk, Thrive podcast.
Hello, everyone. So I feel like I've been quite vulnerable today talking about retention. I think it's something that I have wanted to look at for probably the last 18 months, is just how long we're retaining our clients, and what is the lifespan of our clients that we have come through in the pediatric space. I feel like with my Northside Allied Health, it's fairly, and I work with Proactive who have got loads of data. So I feel like it's quite easy to determine the lifetime value of a client and how long a client stays on board. But in pediatric clinics, it was just something that I think I was starting to realize that we were putting so much into marketing and weren't necessarily growing. Now, there's obviously a few things shifting in the industry or the space at the moment in terms of funding and whatnot, but I think it's important to look from a clinical perspective because I think that if we don't have the right clinical leadership and systems in place, like it can become a significant issue for a business. And I think that that load gets passed on to clinicians because they're constantly having to see new clients and go through new treatment plans and, build that relationship. When we have the clients retained and we're seeing them each week, we can make progress. It's fulfilling. We can try different things and different strategies because we've got that relationship. So there's a lot of opportunity when we retain clients. It is a lighter load, I think, and there's more opportunity for fulfillment from a clinician perspective. And of course, from a business perspective, financially, it is better to retain clients. Now, what I started to realize in my business was we were spending, so our one big area of marketing is Facebook ads. So, and everywhere I go, people are like, oh my gosh, I see Kids Heart Pilates everywhere. And I'm like, you're in my algorithm. So we spend quite a lot on Facebook ads. Now, I think I'd be really interested to hear Em's perspective because I feel like it'd be quite different in a speechy space because it's a more established pediatric profession. Obviously, exercise physiology for children is not as developed or recognized. So we've had to do quite a lot of marketing in the space. But what I was realizing, which kind of not frustrated me, but I guess frustrated. But what I realized is we were actually spending quite a lot of money on Facebook ads, and we weren't necessarily growing in clinic numbers each week. So what I realized with everything that I do is I kind of look at it from a clinical perspective, or I try to understand what's going on. So I want to know why they're leaving and how long they're leaving for, at what time in the year or the term they're leaving, and what we're doing to navigate that really. So we're not basically just churning through lots of clients, because as I said, that can be quite exhausting and expensive. So what I think we need to look at initially, and what I identified when I started to look at this, is one, I didn't have the information. So we weren't tracking in an easy way to track why a client was leaving, because it's not something that we looked on a week-to-week basis. So I wasn't running a report in Clinico going clients without future sessions report, which is very simple to do. So you can do that each week. You can run a report which clients don't have future bookings, and look at it from that perspective, and then actually start to unpack and learn from what is happening. Is it an admin error? Is it because the client's not happy? Is it because they lost funding? Which is all really important information. So we need that information first and foremost. So that's a system, or yeah, an admin or system, I guess, process to put in place. And what I established when I started hunting and identifying why clients had dropped off is there was gaps between school holidays. So every term, we obviously have a 2-week holiday, and then at Christmas you've got a 6-week holiday. So as much as we want sessions to continue through the holidays in a normal fashion, it just doesn't happen. So you definitely have a drop off, and we kind of aim to have about 70%, operate at about 70%. And then we obviously have our holiday program. So that runs to boost numbers during those holiday programs. It's a really good program for our clients to actually come to as well. But what I realized was we're dropping people from term to term, and that happens 4 times a year. So there's 4 big opportunities to leak clients every term. So my brain goes into, okay, what system can we create from a business perspective to stop that from happening? And then what I work with the team on, okay, what clinically can we put into place? And what research and information that we know to be true can we call on and communicate in terms of stop preventing that from happening. So we were identifying a big drop off from term to term, and that was happening throughout the year. The other thing that we recognized was funding, definitely. And there were 2 things with funding. There was one that they just needed a break in funding. There was a gap in funding, so they needed a break from servicing until 3 months' time. And then 2 was they lost funding altogether. So we went through and I started to itemize, code what we were losing them for. So was it term to term? Was it funding? Which funding was it? Because then we can start to actually, from an advocacy perspective, we can actually then go back and say, hey, we're losing this percentage of clients because they've lost funding altogether, or this many clients, 20% of clients are experiencing a 3-month gap in funding, and therefore servicing. And this is what we need to do about this, or this is what the impact of this. And then we can align our clinical practices to assess when they return and look at the impact of that, because I think that's quite powerful. And again, it just comes back to communicating all these things. So we found that it was in terms, it was funding, and another one was when a practitioner left. And they would see the new practitioner for a week or 2, and then they would drop off. And because it was a new practitioner in there, they didn't have the relationship, they didn't know that client very well, so they didn't necessarily chase that client or check in with them afterwards. So the ways in which we have, so they were the big leaks, first of all. Um, uh, and so I started to code them. And then I started going, have we followed any of these clients up? And this is where I'm being a bit vulnerable because I'm, yeah, showing you what we have and have not done. And there was not a lot of follow-up. And so immediately, I started to reach out to all of those clients. I got a bunch booked back in, and it was just again a drop off in, and some of it coincided with a practitioner and a term break. So that was kind of like a double whammy. And then I started to set a recall on Clinical. You can actually put if they're, wanting a gap in funding, but they didn't say want a future appointment, you can put a recall on them in a certain frequency so that that reminds you to contact that client. We also use HubSpot, which is a client management system, and we can assign tasks and send emails and communicate through there so that we can track all communication. But I think first things first is like identifying where they're coming, they're, I guess, leaving, and then putting some systems in place around that. And then from there, it's about really starting to understand why clients actually disengage with a service. So now we're shifting into a more clinical client care perspective. So, and it was really interesting to look at it from this perspective because we have got really, really solid communication, and the way that we communicate to parents is frequent, and I think we do a really, really good job. But when I worked with my pal, ChatGPT, it was so amazing to just outline, like I put in all the things that we could do. And then I spoke to the team about it. And what we realized was that clients disengage when the plan and the goals can be a little bit too vague, or they're not maybe emotionally connected. So, for example, and yes, everything that we do, particularly with an NDIS participant, needs to be linked back to their goals. But we need to, and we do this at Kids Heart Pilates, is we need to look at the NDIS goals, but also what the personal goals are for the family, whether it's engagement, whether it's, I've spoken about one before about, participation in gymnastics, or we had one today that I was on the phone with that was bike riding. So really looking at what are the emotional ties to the therapy from the parent's perspective and the child's perspective as well. And I think another way that, I mean, let's be honest, it's really this retention is, and I talk about this so much in my courses and everything I do, when we're working with kids, we need to connect and build rapport with the child and make it relatable and fun for the child. But we also really need to work on that relationship with the parent, because the child will come and have fun. We can make it relatable for the child, but it's not necessarily easy for the child, and therefore it's not necessarily easy for the parent. And the parents aren't going in and having fun. They're sitting and waiting, or dropping off, or rushing to and from, or, it's actually a fairly big ask to commit to bringing your child to therapy every single week in your schedule, in therapy hours, right? And the available hours. So it's really, really important that we're communicating with parents. They understand what the goals are and how we're getting to those goals. And we're communicating that. We have this all in place with Kids Heart Pilates, but when we reflected upon it, we were like, are we actually communicating this in an effective way. And one of the things that we were picking up was quite a few parents were coming and wanting to have a big conversation after their session. So I said, well, if we were communicating effectively, then they wouldn't need to be having that massive conversation with us. So if they knew what the goals were, knew that how we were reaching those goals through our therapy plan, and then been given updates, then we shouldn't actually be caught in that situation. Uh, and so what we've started to offer is some parent sessions so that we can give them an update once a term where we sit down, it's with the parent, it can be done over the phone as well. And it's a parent session that we will update them on how the child's going, the booking plan, the scheduling plan, what we would recommend over the holidays, all of those things. Do they require a report? When do they need their report? When's their review? All of those things that we really need to be keeping them in the loop with and keeping ourselves into the loop with, formalizing that communication. So I think at the end of the day, when the parents know what we're doing in therapy and why, and they start to understand that, and then what it's leading to. So, school transitions, behavior, regulation, all of those things, and things that, are potentially relevant to them. So we need to talk in a way that is relevant to the parent, and the child's development, not oh, they're able to balance for X 30 seconds. What does that mean? We need to be communicating what that actually means, what that allows them to do from a participation perspective, participation in sport, participation in school, participation socially. What are the functional outcomes of the therapy that we are participating in? So, really clear goals, communicated goals and therapy plan. Parents understanding what we're working on and why, a really structured follow-up and communication plan. And that could be through emails, it could be incorporating it into the session, or it could be that parent session. And then starting to, starting to really get a flow of that communication and that plan with that child and the relationship with the parent, because I really think that they need to understand before we can do that. So these are things that we've implemented. So we've tightened up our assessments. We've now changed our assessments, and I'm updating the assessments, which is all part of my courses, which is an assessment template. I've got a pre-assessment interview, getting subjective measures and like a questionnaire, and it's all functional. It goes around sleep, diet, participation, school, any challenges that they're experiencing, regulation, engagement, behavior. So going through all of these things, getting a really thorough picture before we see them, then documenting all of that once you've seen them and done an assessment, and referring that back to their functional capacity and their functional outcomes, and then having a formalized catch up with parents in a 3-month intervention to update them on how it's going, what we're planning next, and what we would expect to see. So almost like what we would do in a report, but communicating that to parents and making sure that that is really, really, really clear. We make sure that we have objective measures in every session. We have clear reporting language, pre and post assessment structure, re-engagement systems, all those parent conversations in place. And then we've got, identifying those children that are losing funding, and putting that into our advocacy work, whether we put what's it called, when you put a complaint and feedback into NDIS, or taking them down the Medicare pathway, and really looking from a clinical perspective at the interruption of services if there are gaps in servicing. Really, really important that we're documenting if they do go backwards, and over what period did they not have the service, and how did they go backwards? Because when families understand and we understand the functional impact, they stay. They are connected, and when it's connected to their goals, their personal goals, which then would connect to the NDIS goals, then they will stay. And we will also be more confident in our communication. As I always say to my team, you are advocates for this child. When this child is brought in, you are there to be an advocate, to express what you are clinically seeing in terms of presentations, assessment outcomes, and those functional outcomes, engagement, participation, and there'd be obviously so many from a speechy or other allied perspective. This is from the EP perspective, but these are things that we will look at through movement. So obviously what we do as exercise physiologists is we look at everything through a movement lens, so that we can identify through looking at core strength, and linking that, or core strength, fine motor skills, and then linking that through back to function, whether it be participation, engagement, all of those things that I have been talking about, and how we link motor planning to confidence, and how different families will see this progress differently as well. We need to remember that they are investing in participation. They're not just buying sessions. They're really investing in this relationship that they're building with us and the value that we're providing. And the value that we're providing goes so far beyond what happens in that session. So they're all the things that I've learned about retention. I think really, really important to track and understand what's going on, where you're leaking clients, if you are. Understand why. So when and why, and then put some systems in place to stop that from happening, or prevention, I guess. And then clinically, how can we be communicating our clinical plan and goals in an effective way that presents it in a functional way to families, so that they really understand the value of what we are doing, the flow-on impact of what we are doing, and they're connected to that. They know what the plan is, they know what the goals are, they've got access to us from a communication perspective, and they know what the plan is going forward. So they know, like, you're on the front foot in terms of those holiday leaks and so on, and you've got that relationship with them. So they're the things that we're trying. And I think really when we look at it from a functional perspective, we need to be all over that. So from an EP perspective, what does a good core strength lead to? What do gross motor skills lead to? I was on the phone with someone today, and they said, oh yeah, we really need to work. I said, what are the challenges? She said, oh, we really need to work on fine motor skills. And I said, well, before we can nail fine motor skills, we need to have, so if we're talking about writing, we need to have really good gross motor skills through our shoulder function. So we need to have a strong shoulder function to be able to hold our arm in the right position, to then work on those more intricate skills. And before we can get our shoulder function to work adequately, we actually need to have a nice healthy posture, and we need to be able to sit for sustained periods to then comfortably to be able to work on our shoulder function, to then be able to do the fine motor. And she was like, oh, that's so interesting. So I think in all of those conversations, from inquiry through to interactions with them, through to reporting and emails, through to following them up and re-engaging them, we need to be, and all of our marketing, we need to be talking about clinical function and how our intervention impacts that. This is very much what I do in all of my courses. So I talk about how we look at everything through a movement lens, I should say. We identify what a child is struggling with by looking at the way that they're moving, the way that they're sitting, they're holding their posture, they're walking downstairs, throwing and catching a ball, jumping, how they're moving in entirety. Are they fatiguing? Are they able to stop themselves from dancing in a freeze game? We're looking at it from a perspective through a movement lens to identify what is going on from a holistic perspective for the child. And then we're using movement strategies to then help with those areas that we see need help. We then need to communicate that. So the work we do is amazing. It's about communicating that really effectively. This is the confidence that I want to instill in the people that I work with, which is exactly why I put my courses together. And don't forget that I have got in-person courses this year in Brisbane, Adelaide, and Sydney. You can check those out on my website. But if you have enjoyed this episode and got some good little tidbits which you can implement into your work, I would love to hear how you're doing it, or if you've got some other strategies that I haven't mentioned, it'd be great to hear those as well. And don't forget to like, share, and review. I got it right this time. And hopefully we see Emily soon. She's still very much in her baby bubble. And so she should be. And next week, I've got another fabulous episode coming your way. All right, guys, thanks so much. Bye.